We have notified everyone known to be in contact with this individual.
D.C. Department of Health Director LaQuandra Nesbitt says the new case does not appear to be connected to a giant outbreak in California, and it also doesn't appear connected to D.C.'s other case a few weeks ago. She wouldn't give out any details about the new patient, but said the person didn't go far after contracting the measles.
The measles outbreak in America continues. The District of Columbia has now confirmed its second case here in 2015. It does appear to be slowing, but then there's the matter of the nasty incubation period. This, as we must consider a positive side to the disease outbreak, though there will always be those who won't see the truth no matter how dangerous it might be to themselves or even to others. It's a pleasure to welcome back to MidPoint noted medical expert, syndicated radio talker, board certified, and two-time recipient of the Patient's Choice Award. She puts the medical jargon into simple English for us to understand. Dr. Elaina George joins us. Dr. George, good to see you again.
It's a pleasure to be back with you.
I'm always trying to find the positives in situations such as this, and even as the disease continues and we find new cases in D.C. and other places. Is it perhaps a good thing that we thought measles was eradicated? It is back, but now it's shining a light on the vaccination issue and the fact of how people must care for these vaccinations, and they must worry about not only their kids, but the kids who just happen to be passing them by, maybe in another room somewhere, maybe in a doctor's office. Maybe that's a positive side here.
Well, I think this is a debate that needs to be had at this point. There's a big push for vaccination for everybody. And I think that I may be a little bit outside the box, perhaps, but I think people should have a choice. There's a lot of data out there that suggests that the vaccinations are effective, and there's question marks in some of the other data. And I think people need to do their own research and do their own due diligence. And I'm not so sure why this outbreak is happening. Remember, we had a lot of people come into the country over the summer who aren't vaccinated, who have come from countries that have never, their outbreaks are happening there. So those may be the people that are coming in with it, not the people who've done it and had vaccinations by their pediatrician. So there's a question mark why this is happening now.
Let's talk about the choice issue here. Is it not fair to say that many of the people who are not getting their kids vaccinated, that they still, many of them, rely on debunked information, outdated information, that there are those issues in there that may be of concern, but much of what we hear coming back is still based on information that has been completely disproven?
I don't know if I agree with that statement. I think that most Americans are vaccinated, and if you use the criteria of herd immunity, then a majority of the country is vaccinated. It should not be a concern, because the people who are vaccinated are protected. And the way this is the way it's playing out is as if the herd is now at risk of getting measles, and that's not the case. I think the people who are coming in or who have not been vaccinated are the ones that we're seeing perhaps coming into doctors' offices. So, either you believe in herd immunity or you don't, and you do not have to vaccinate 100% of the people to get protection.
Okay.
By definition.
Okay, and granted on that, but then here's a case, and this comes out of, we've heard this in a number of places. Here's a woman in Toronto who took her 15-day-old baby into a doctor's office, and it turns out that there was a contagious measles patient in the waiting room on January the 27th. She had to sit and wait. She had to be concerned about her baby, and she puts it here, she is angry as hell. Aren't these the people that we really need to be concerned about, these youngsters who simply can't get vaccinated, and if they're exposed, they could die?
Well, measles does not have a big mortality rate, so let's not use measles as the...
But it does have an occasional, correct? Just like everything else,
frankly,
it is the possibility.
The doctor's office should have had that patient quarantined in a separate place. Anything's possible, but I think to say that the vaccine is 100% effective is not true either. This is medicine. Nothing's 100%. So to give people false security that if they do this, they'll never get it is not exactly true either. And there are people who've been vaccinated who did come down with measles, and that's actually in the insert.
Would you then go along with some of the studies that are out here? I only got about 30 seconds. We'll take a break. But the CDC points out the majority of people who've gotten measles in the outbreak were unvaccinated. What does that tell us? It apparently tells us that there's a slight technical difficulty right here, so I tell you what we're going to do.
He also
Hold
said-
on one sec, Dr. George. We're going to go ahead and put you on hold for just a moment here. We're going to go ahead and reestablish connection. We have to take a break anyway here, so it's a good time to do that. But the CDC did talk about 141 patients in 17 states, and the District of Columbia, I do want to make that point, that they say the majority of the people who have gotten the measles in the current outbreak were unvaccinated. We're going to take a break, come back on the other side with Dr. George. We're going to turn to the Obamacare side of the medical debate, what the administration may do if indeed the Supreme Court knocks down a key component of the law. And is it really working? MidPoint continues. All right, we've got everything all taken care of now, so let's welcome back to MidPoint medical expert, keen insight into the political world of medicine as well. Dr. Elaina George joins us. Dr. George, glad to have you back. We wanted to go ahead and switch a little bit to Obamacare here and get your take on a lot of this, because we are all still waiting now. It's been sort of quiet on the Obamacare front, waiting until March 4th. The Supreme Court then will decide, and the Obama administration now has to consider what they would do if they lose. Republicans are thinking about what they will do if they technically win. What do you think may happen? What could be the real downfall here if indeed the Supreme Court rules against Obamacare?
I personally don't see this as a downfall if they rule against Obamacare. And as a practicing physician on the front line, the Obamacare insurance system is not working. People who come to my office who have that are just shocked to find out that even though they're paying their deductible, even though they're paying their premium, they can't afford their out-of-pocket costs. They're way too high, and people are foregoing treatment. They're canceling appointments, and I thought the whole point of this was to have people be able to see the doctor, and that's not happening. And to top it off, I've said this before, we're no longer on the front line of treating our patients. We don't get to choose as physicians what the course of treatment is. It is now the insurance companies. They're saying what's medically necessary. They're deciding whether something gets covered, and they're denying care left and right. I've never seen so many letters of denial come through.
Dr. George, I will tell you this from personal experience, and this just happened yesterday. I went for a basic checkup with my doctor, and he said to me almost exactly the same thing. He said, anymore, I tell my patients that I am not necessarily telling you what to do, nor am I even advising you. I'm going to give you a concept on what to say and what to do, but then again, it is completely up to the insurance company. This was frightening when he said this to me, because I said, so in other words, you're my doctor, you can tell me what I need, but I've got to worry about somebody sitting in an office to tell me what's really good for me and what I can afford. Isn't that the real reality of this, that the administration doesn't tell us?
Oh, absolutely. This is now a centralized medical system where it's done by committee, and that committee is not based on individualized patient care, it's based on cost. And you can see this now emanating throughout our society. There are even, some of the government officials are starting to think about euthanasia, where they're trying to pay for people to talk about whether or not they want to do hospice, whether they want palliative care. And doctors are now getting paid to do that, but they won't get paid to send them for a CT scan. I mean, so they're now pushing the onus of healthcare towards make you comfortable, don't do anything that's going to really be heroic to save the system money. People don't realize that, but they're not going to be happy when they end up on the other side of that conversation.
Do you have any doubt that, unfortunately, I got about a minute left here, but when it comes down to treatment of patients, that one of these days we may get to the point where a doctor may have to make a choice between saving a buck, making a buck, getting the right insurance company involved, keeping their license, and life or death from a patient?
I think we're already there, to tell you the truth, but it will not be the doctor deciding that. Because most doctors are now employees of hospitals, it's being driven by the system. So they have to work for something. They have to follow the protocol of the hospital system they work for. That decision is already gone.
What do your patients say to you when you tell them that?
Well, I don't belong to a healthcare system. I'm an independent doctor. So I have a direct relationship with my patient, and we decide what goes on with their health care. I will never let some government entity step in the middle of my doctor-patient relationship.
I only got a few seconds left here. I only got a few seconds left here, but if something happened and you had to go to work for somebody and they told you to make these kind of choices, would you get out of medicine?
I sure would. I would not do it.
And that is a frightening thought, because I think that's what's happening to a lot of doctors around America, where they are deciding basically to retire and no longer be involved if they can't take care of their patient. Dr. Elaina George, it's always an eye-opener when we get a chance to speak with you. I thank you so much for your time, and we'll talk again soon.
Thank you. I look forward to it.
All right, take care. That is exceptionally frightening when you think about it, that somebody sitting in an insurance office somewhere may be the one to make a decision on your health care. All right. One has to be fairly intelligent to run the most powerful nation in the world. Maybe it's possible to do it without having completed college. Scott Walker's been slammed for not having the sheepskin, and his reaction to recent criticism makes for interesting politics. It's coming up next here on MidPoint.